anatomical and individual functional features. Of course, individual mimic patterns. We can use different techniques and combine it, and we can use different dilutions volume for botulinum toxin. Taking into consideration the scientific data, the area of post-injection denervation depends on, of course, first of all, the dose of the toxin, volume of the dilution, points of injection, and precise of injection in a targeted muscle. I speak about volume dilution. And here you can see the picture I have drawn, and I have called it traffic light. And zones where our work relatively safety are marked in red. Zones where our work can be maybe a little bit risky, marked in yellow, and in red there are zones where we should be very precise, and we should be very careful working with botulinum toxin. So, frontalis. The correction of the frontalis zone on the one hand is a very easy procedure, but on the other hand it's difficult because of the risk of pulling down the eyebrows. So in this case, I usually use 2 points of dilution of the botulinum toxin. Concentrate dilutions, one vial 100 units in 1 milliliter normal solid on the inferior part of the musculus frontalis, keeping in mind the safety distance between eyebrows and our injections. And the upper part of the musculus frontalis we can use standard dilutions. And of course, if we have very narrow, for example, forehead, we can use concentrate dilution at all muscles. Here you can see brief video. Just a moment. Yes, brief video of the injection, and our injections are intramuscular and even subcutaneous sometimes, and we always keep in mind that musculus frontalis is only levator muscle in the upper face, and we should be carefully to treat it and not to paralyze it, but only weak it. So this is a clinical case before and after 14 days the procedure, and we should treat very precise without pulling down effect of botulinum toxin therapy. So when we correct the glabella zone, we work with depressor muscles, and we should keep in mind that depressor muscles always interactive with the inferior part of the frontalis fibers, and I prefer to use concentrate dilution when I treat in the glabella area, and our injections have to be very targeted directly to the muscles, and we can use the dilution of 100 units vial in 1 milliliter normal saline. Here you can see video when I inject musculus procerus. I prefer to direct my needle perpendicular directly in the belly of the muscle, and when we treat the depressor superciliar muscle, we have to be very precise, and our injections have to be in the very superficial plane, intradermal, because of the very close fibers to the skin. So when we inject corrugator, I prefer this technique sometimes to inject from one point and direct my needle very deep at the proximal part of the muscle. And when I leave my needle, I leave a small amount of the product on the lateral part of the muscles. So it it is safety for the risk of proptosis. Here you can see the results, and it is very important that we have to lift glabella but not to pulling down it, because it may happen if some diffusion will be with the inferior fibers frontalis, inferior fibers of musculus frontalis. The periorbital zone is a very interesting zone, and there are many points of view how to correct these wrinkles, but in my opinion the very safety zone is the lateral part of musculus orbicularis oculi, and we can use a standard dilution here. But when we work with a palpebral part of the muscle, for example white technique or some other, when we inject to lift the eyebrows, we should use concentrate dilution and very low doses, very precise and low volumes. Here you can see the technique. Our injections are very superficial because our task not to paralyze musculus orbicularis oculi. Our task is removing wrinkles, so we have to work only with superficial fibers of the muscle. Here you can see the results before and after 14 days after the procedure. When we work with the middle part of the face, perioral zone and nose, we should take into account that it is a very narrow therapeutic window, and we can use minimal effective doses, and we should take into account the complex of interaction of muscles, so our injection have to be very precise, and I prefer to use concentrate dilution 1 milliliter to working in this area, and two-step correction, because we can invite our patients 14 days later after the procedure, and we can to add some product if it will be needed. And this is results before and after. And when we work with the lower part of the face, we work with depressor muscle, depressor anguli, oris, mentalis muscle, and upper fibers of platysma using lifting techniques. And when we work with down and mentalis, I prefer to use concentrate dilution, and our injection must be very precise. We have to palpate and identify muscle and inject directly because of the risk of delay. So, which dilution I prefer? I prefer concentrate dilution, but when we work with the platysma, a standard dilution it will be okay, and our injections must be very precise. Superficially when we treat in depressor anguli oris, and deep to the belly of the muscle when we treat musculus mentalis. And for me it is very important zone, it is must-have zone for our patients, because we can change negative stereotypes of our patients, and we can remove wrinkles, and our patients will be more happy. So, before and after. And the last point of my speech, neck, and it is, in my opinion, 2 points of view. When we work with the platysma bands, standard dilution can be used. It's very useful because platysma is very wide muscle. And the second, I direct my needle laterally to the band, directly to the band, and the distance may be 2 or 3 centimeters between. And the second point of view, on the neck, where can we use micro-injection, and we can use high dilutions, 100 units, a vial for 5 milliliters even, but a common dose is not very big, and we do our injection very superficially, intradermally. Our task to decrease the tense of musculus platysma and to smooth the skin relief. So high dilution can be used in this area, and also we can use a high dilution when we treat hyperhidrosis. I use it in my practice too. So this results before and after, only botulinum therapy without any additional methods. And in conclusion, to sum up, I said before, I show you the global scheme where in what muscle is most safety, use standard dilution or concentrate dilution. And of course, our choice based on functional and anatomical features of individual patients, on our preference on our goals of treatment and what our patient desire. I think it may be helpful to individualize our botulinum therapy scheme, and of course, in my opinion, it's very, very useful in conclusion, it's very useful because it makes our work more interesting and more creative. So thank you a million for your attention and be in moment of botulinum therapy. Thank you.